Heidi, and I've travelled all the way back to the Isle of Man today specifically to have my Botox done by Dr. Bell, and we thought it might be a nice idea to do some reality Botox and show everybody how it works and show some of the advanced techniques.
And now everybody that's looking will think, now come on, Heidi doesn't need any natural enhancement. Heidi, how many times have you actually had Botox before?
This is going to be my 4th time.
And how do you feel, or why do you have Botox?
Because when I feel good, when I look good, I feel good.
And you know what, ladies and gentlemen, yeah, she looks pretty good to me, yeah. It's so much easier. How old are you?
I'm 34.
I mean, Heidi's probably our typical client. She's 34. What we're going to do, if you can, frown for me, Heidi. Okay, so we're going to inject into the glabella. If you raise for me, Heidi, we're going to do a forehead. We're going to do around a crow's feet, big smile. And Heidi, tell us, this is your top secrets here, which bit do you really hate?
The bit I really hate is my bum chin.
So I'm going to inject a little bit of Botox in there just to relax that area. And also, Heidi, if you give me a big smile of those lovely white teeth that we've whitened, I'm going to also drop the top lip, so basically reduce the smile so she doesn't have such a gummy smile.
Yes, because this used to be my natural smile.
Perfect. So, as Heidi's just explained, it's 6 o'clock or 10 past 6 on a Monday evening, so it is reality Botox. What I'm going to do is I'm going to inject into the glabella area, into the forehead and around the crow's feet, first of all. Botox, the big facts about Botox, it's one of the most simple, safe and effective treatments that I provide at Tracey Bell. I'm a great advocate that it should be utilised in a manner to give us a nice natural result, and Heidi's probably one of my ideal clients. Heidi, you probably had it again, as you said, about 4 times before. She's always been very happy with the result, and you know what, at 34 she looks good for her age. So first of all, what we do is we ask Heidi to frown for me. Heidi, relax for me. It's a simple procedure where we basically place a little bit of Botox into the glabella area, and these muscles are the muscles that pull you down and in, so they make us angry. They give us the typical legs 11. It takes round about 3 to 5 days for Botox actually to work. Heidi, if you like to raise for me as well, the forehead, as we age, what happens is our muscles, like going to a gym, have to work harder in order to lift, defy gravity. So what I'm going to do here, it's a simple case of normally 4 small injections. You okay, Heidi?
Fine.
Heidi, tell the consumer, how does it feel?
It doesn't, you really cannot feel it. There's no pain. And prior to starting Botox treatment, I was very needle phobic, and it has helped me because it's such a fine needle that there's no pain at all. You really can't feel it, which sounds strange because it pierces the skin, but you cannot feel.
So much so I've even got you to go to the dentist nowadays, haven't I? And that's one of the things I think that any procedure, obviously they're frightened about the outcome, but they're also frightened about any pain that may be associated with the likes of Botox or a non-surgical procedure. So for me and the client, it's very important. They are trying to reassure them. Hence, that's why we're making a video, reality Botox, so you can see exactly how it's done real time. So again, Heidi, if you just turn for me, the crow's feet or the orbicularis oculi, this muscle, when you smile, gives us that typical look. Again, all I'm going to do is very, very superficially is inject around this area just to relax the muscle. What it will do is it allows us to give me what I call a chemical brow lift within that area. Heidi, how did you find that?
Fine. I always find it fine. It's a little modern miracle. I love my Botox.
And Heidi knows everything about everything, don't you, Heidi?
I love
She does her research.
physiology and bodies, and if I'm going to have something done, then I go onto the internet and I make sure that it's safe before I have it done and that I know everything about it, and then I find the best person and I go to that person.
Okay, Heidi, if you just turn that way for me. And again, very, very, very superficially. You'll see that the little bump comes up straight away. That's basically saline. That's what we mix Botox with when we inject it. that normally disappears within round about 5 minutes. So again, what would normally happen is the client would come in, we'd ask them to fill in a medical history, we'd ask them to fill in a consent form also, and effectively what we would then do is that we'd take some pre-operative photographs beforehand, ask the client to give us some expression, to smile, because remember, everybody's different, so we'd ask them to smile, we'd ask them to raise their brows, we'd ask them as an individual what they want. And that's important, Heidi, I think, isn't it, as well? Okay, so if we're going to go into this part, Heidi, I want you to just raise your top lip for me. Yeah, okay, relax for me. And what we're going to do here, very, very superficially, is we're just going to inject just into this part here. Okay, Heidi? Mm-hmm. And again, this is a very, very effective treatment just to drop that top lip. Heidi, if you make that, yeah. Again, this is the mentalis muscle, quite a deep muscle. And what I'm simply going to do here is inject some muscle, some Botox into this muscle here, and that will just relax the whole area. So effectively, Heidi has had a full face treatment in Botox. She's had her glabella, so her frown, treated. She had a crow's feet, and we've done some work on the lower part of her face, and that is just to drop that gummy smile and also to relax the muscles. As we age, what happens is the muscles contract. So again, around the cheek area or the chin area, we've simply injected there. Heidi, we would normally say, so Heidi, no exercise for the next 2 hours. Don't fall asleep for 4 hours. And Heidi, you're going to sit up and tell everybody that's going to watch this video, how do you feel?
I feel great because now I'm going to get on with the rest of my life. I love my face, I love the Botox, I love that it builds up and I need it less and less, and that it just helps to make me look good for my age, not to make me look artificial for my age.
And Heidi, I would say, is one of our typical clients. She's a good, loyal client, she's an educated client, she knows exactly what she wants. My thing is trying to get inside of Heidi's head, to understand that when she looks in the mirror, what bothers you really, Heidi. And I think that's important from a practitioner's point of view in order to assess that. So Heidi, thank you very much for the video, I'm sure that everybody on YouTube and wherever else we put this, because it has been done straight off the block, I should say, she's proud to say that she has Botox, and she's a really, really good customer. Thank you, Heidi.
Thank you.